when I saw the title of this panel, EcoHealth, and how communications must convey that a healthy planet equates to healthy people, I knew even before I looked at it that this was going to be a Finn Partners panel. It just sounded like a Finn Partners topic. It's challenging, provocative, and extremely timely. And here to lead the discussion on EcoHealth is Bob Martineau.
Thank you, Paul, and welcome everybody this morning. I'm pleased to introduce our two distinguished guests today to have this conversation about public health and environmental issues. First is Rachel Hodgson. She's the president and CEO of the International Wellbeing Institute. Rachel joined IWBI in November 2016, bringing her broad sustainability expertise and her track record as a leading global advocate for green schools and social equity to IWBI's work to advance human health through better buildings, more vibrant communities, and stronger organizations. She was named president of IWBI in 2018 and the CEO in November 2020. IWBI has over 2.5 billion square feet of space registered, rated, or certified in 97 different countries. IWBI's evidence-based well offerings anchor an ecosystem of solutions that advance, measure, and monitor real estate features that help people thrive. Our second distinguished guest is Dr. Yele Aluko. He's the Chief Medical Officer and Managing Director of EY Americas. In this role, he is a member of EY's Health Sector Board and advises health system C-suite clients on mega trends confronting the health industry, enterprise growth strategies, and business operations. He is a visible and vocal advocate for the elimination of health disparities in the United States and is the director of EY's Center for Health Equity. He led team members through the articulation and design of EY's health equity point of view to enable progress towards elimination of health disparities and achievement of health equity. Good morning, and thank you for participating in this important discussion. I want to kick off the conversation and ask each of you to comment on recently the World Health Organization issued a report on the impact of climate change on health, further highlighting the interconnection of public health and climate change. The report estimates 250,000 additional premature deaths per year globally between 2030 and 2050 from climate change related issues if we don't take strong, rapid, and sustained reductions. Can you share your thoughts on the report and how we as communications professionals can speak to the sense of urgency that this report highlights? Rachel, I'll start with you.
Thanks, Bob, and thanks so much for having me today. I mean, look, that report is more than cautionary. It's a code red moment, is what that report refers to where we find ourselves today. And it is a code red moment. It's an opportunity from a communications and PR perspective for us to really come face to face with the fact that the messaging that we've been utilizing, the way that we've been communicating the urgency around climate change really isn't working. Our commitments aren't big enough. And in many instances, we're not even on track to meet the commitments that we're already making. And so, I think it's a cautionary tale, but also a real opportunity. But we can't be kind of tempted to revolve our messages around that notion of this being a code red moment. We know that the doom and gloom messages just historically have not inspired people to take action, to change the way they're living their lives and operating their businesses and engaging with their communities, the way that they're voting. And so I think, ultimately, and I'm looking forward to talking a little bit more about this throughout the panel, the imperative is really to personalize this for the individual, and to make it about, what you gain as opposed to what you give up, to make it about abundance instead of scarcity, to make it about the health of your family, of your community, of yourself, and utilize that as a much stronger and more effective call to action than what we've often done, which is simply try and translate the science to the mainstream, and present them with the kind of distant images of like polar bears clinging to the very last ice flow that just, ultimately depersonalize, not personalize the message.
Thank you. Dr. Aluko, your thoughts on this?
Yeah, thank you for asking me to provide insight today. And I appreciate what Rachel just said, and I'm in total alignment with what she said. Now, this report, which was issued earlier this month, was a very extensive macro level assessment on climate change that builds on our existing body of intelligence from the 2018 report on the impacts of climate change on human health. And from a marketer's perspective, it's important to understand that the messaging has to connect the impacts of climate change on human health. I'd like to reference maybe 3 broad areas within this report. So it underscored and it re-emphasized the impact of this climate change that's driven by global warming on the social determinants of health. Marketers need to understand how to message the awareness of social determinants of health and how this context disproportionately impacts the health of not just lower income or middle income countries and communities, but all communities. It also impacts upper income countries and society. So that's number one. Number two, by so doing it again underscored the close intersection of public health, care delivery, and climate change. And that messaging needs to be distilled in a manner, like Rachel said, to an individual perspective. From a more macro perspective, it also reiterated the imperative that country governments adopt climate action to mitigate the adverse impact of climate change. Most importantly, it did come up with 10 sets of recommendations to guide them in prioritizing action and executing on strategy to do so. Fundamentally, the marketeer's messaging must resonate with individuals, with organizations, and with countries.
Thank you, Dr. Aluko. Thank you, Rachel. Picking up on that theme, I think that's a perfect discussion point here of how to make it personal and real. And we continue to see the politicization of science and public health and environmental issues. We distrust our government. We distrust the media. We're skeptical by nature and humans. And simply laying out, as you said, Rachel, scientific facts does not persuade people to act, particularly when they're seen as big picture issues. We saw that somewhat during the pandemic, and we've seen it a long time in environmental and public health issues. How can communications professionals bring that down to that individual behavior you both reference and spur them to act without creating that sense of panic? Is it the message? Is it the messenger? What are some tactics or ideas you would offer to make that personal, that will capture somebody's attention to act and change their behavior for the positive?
So I'll give 3 pieces of advice.
Okay.
The first is accept the fundamental premise that intellectual agreement is not inspiration to act, that better science is not going to convince the skeptics, that 99.9 scientists agree with the premise of a changing climate that is human driven, hasn't prompted a 99% intellectual agreement and set of actions by the general public. And stop demanding altruism. And that leads to my second piece of advice, which is really to think about how we personalize this message. Back in the day, when I was at the U.S. Green Building Council as the founding director of the Center for Green Schools, we partnered with Ogilvy Earth to undertake a series of focus groups in preparation for the launch of our Green Apple public awareness campaign and cause marketing brand. And we interviewed groups of parents and we tested different positioning statements. Greener schools can help to prevent your child from having an asthma attack. Greener schools can, reduce energy and water needs and, put more money back into the classroom. every single one of our messaging points failed horrifically with these groups of parents. They all put their heads in their hands and said, I cannot handle one more thing to worry about. The only positioning statement that won across the board with every group of parent that we organized was, don't you want to give your child one more opportunity to succeed? It wasn't tied to climate as a message, and it was tied to a message of positivity and hope, and not fear. And then my third piece of advice is really to tap into what we've come to understand from behavioral scientists, really prompts behavior change. And that is comparison and competition. What are your peers doing? What are other parents like you doing? What are other consumers like you buying? The more that we show those comparisons, the more that we give people a means to understand what their leading peers are doing and how they can aspire to join in their peers in doing the right thing, the more I think we'll be successful in actually prompting the kinds of shifts in consumer spending and engagement and demand that we're looking for.
Very interesting on that behavior change in schools. So very good lessons to learn. Dr. Aluko, your thoughts? Any comments you want to add to that question?
Yes. So we're certainly going through a very difficult phase of intellectual and emotional conflicts that has resulted in mistrust of all the entities you referenced. In addition, we've seen the more than occasional misalignment of messaging between government, public health, biopharma itself, healthcare delivery leadership organization, and this further compounds a public sentiment of mistrust. And as I mentioned earlier, people are more likely to respond, and Rachel has alluded to this a couple of times, people are more likely to respond to insight driven from a micro perspective as to how climate change affects their individual lives, their family lives, and less so on the macro impacts of global warming that maybe be difficult for people to relate to. So from a marketer's perspective, it's important to develop internal competencies that ensure they have a deep understanding of the multiple demographics that comprise our society today, and that issues in one can trickle into others. Understand the messaging on climate change and public health. It is so important, more so now than ever before. Now, one message doesn't work for all. And to be effective messengers, marketers themselves need to be fundamentally insightful on cultural backgrounds, marketing strategies and tactics that are most likely to resonate within diverse populations that we're seeing today. And marketers themselves should be unbiased in the messaging. Medicine, public health is not an exact science, but we have a lot of directionally accurate, scientifically validated information. So marketers should seek credible and verifiable and validated thought leadership as their source of truth for content marketing.
Good. We've talked about the message and personalizing it and making it positive to change behavior. And there's always two parts in communications. There's the message and there's the messenger. We've seen the government officials get resistance. We've seen, as Rachel said, the scientists standing up there and talking about all the scientific evidence, even though it's virtually indisputed, doesn't get the message across or doesn't get behavior change. What about the messengers? Who are the messengers? Is it faith-based organizations? Who will people listen to if we craft the message the right way? Any thoughts on how we find the right messengers? And as you say, Dr. Aluko, maybe it's different messengers for different audiences, but thoughts on getting the right messenger to make that communication? Rachel,
Dr. Aluko, you want to start? I wanted to defer to the doctor this time.
Yeah.
People tend to listen to those they respect and those people they trust. And that doesn't necessarily mean that messengers must be of the same racial, ethnic backgrounds to be trusted. messengers that have cultural sensitivity and empathy and insight into individual demographic concerns, struggles, aspirations, and so on are the more effective ones. Fundamentally, being aware that this is not a cookie cutter process, but strategies must be customized for different demographics. And part of that strategy will be the choice of the messenger. Now, a Caucasian messenger can be very effective in Black and brown environments if the Caucasian messenger is prepared with the understanding of the audience within a historical context of mistrust, within a historical context of suspicion, if that messenger has developed competencies of cultural empathy and sensitivity. It is true that Black and brown messengers, respected leaders, community leaders, faith-based organization leaders of the same race, sometimes gender, may get that resonance quicker for the reasons I've mentioned. But the strategy must engage messengers that are aware of the content and the context and have the skill to message with empathy and with validated information.
I'll build on what Dr. Aluko said and say that, peer-to-peer communications are often most effective. So identifying who those trusted advisors and peers are is critically important for shifting mindsets. I actually think this is one of the places where we dropped the ball in the early days of the pandemic. We should have been doing more, not just to empower, doctors and scientists and politicians to talk to the general public about what they could be doing to slow the spread of the virus. We should have gone more quickly to celebrities, to spiritual leaders, to community level designees, and really activated them. And that certainly has happened over time, but it took a while for us to catch on to that strategy. And I think we missed some of our window to address the skepticism that's taken root and the politicization. Bob, I trip over that word like you every time. Politicization, that one. But I would also say that we need to activate storytellers, people who capture the hearts as much or more than the minds. And again, this is where we often drop the ball on messages of climate and public health. We think hitting people with the data and the facts is going to be most compelling. It's not. There are ways, of course, and a lot of the folks I'm sure on the line understand this better than I do, but there are ways to actually test for the level of trust and confidence that a consumer will have in any particular designee. And we recently did a public awareness campaign around our COVID-inspired designation, the Well Health Safety Rating, which was a strategy to help businesses and organizations welcome people back with confidence into the spaces where we live our lives and as we emerge from the pandemic. And we activated a variety and a diverse array of celebrities and public health officials in that, from former Surgeon General Dr. Richard Carmona to J-Lo, to Venus Williams, Michael B. Jordan, Lady Gaga. But we worked with CAA to actually put each of those names through a methodology to test the level of trust and confidence that consumers were likely to have around a whole host of different topics that we were sort of covering, the span of topics that we were covering with well health safety. So we looked at it through the lens of wellness. We looked at it through the lens of public health. We did research. We looked into their social media feeds. Were they themselves modeling good behavior? Were they wearing masks? We thought a lot about equity and a lot about diversity. Who were the different messengers in that, celebrity mashup who are going to speak to the whole, array of individuals that we were trying to reach in the general public? We looked at, everything from age to race to their appeal with the LGBTQ community. And we were looking for, to get as close as we could to 100%. So it's not to say that you would, as an individual, trust every single one of those messengers, but you would likely find someone in the entire span of that ad who you could really relate to, who you knew and who you trusted. And then we activated each of those ambassadors through their own social media feeds. So really meeting their fans, and their listeners where they already were. And that proved to be extremely successful. And we had really high rates of engagement with the consumer audience, and high levels of trust that those different ambassadors were sparking in each of those speakers.
If I may just add on to that, if I may, the strategy around marketing is not new science. It's very developed. What is new is a realization that strategies to address vulnerable populations within the context of COVID have not been developed or have not been prioritized. So everything that Rachel mentioned is spot on, but the gap exists because of the absence of a deliberate strategic process through content, context, messengers, communication channels, distribution networks to reach vulnerable populations so that they too benefit from the opportunities of science. And this speaks to the broader context of health disparities. So there needs to be an awareness about health disparities and health inequities, and messengers and the message has to be customized to resonate within all communities and populations.
Very good observations, and I think you're spot on, Rachel, in the discussion about we came too late to find the right messengers to speak to certain audiences. And much like we market a product, your shoe, sports shoes or what, we look to athletic figures and music figures and TV personalities as credible sources for getting somebody to buy a product. And in this case, the product was COVID. And segueing that into a discussion about COVID, and we'll come back to the health disparities. With COVID, the health impacts of the virus were immediate, real. You saw people get sick within days of exposure, and many die, unfortunately, very close in time. We all have a personal experience, friends, family, colleagues that saw COVID. With many public health issues, environmental issues, determinants, the manifestation of those health issues is years and sometimes decades away, and there's causation links that are tougher to prove. What are the lessons we can learn? You mentioned one about getting the right messengers. Are there other lessons that we can take, despite the differences in how the illnesses manifest themselves? Are there lessons from COVID we can take to apply to climate and other public health issues to increase that sense of urgency and change of behavior? I'll start with you, Dr. Luco.
Sure. So I think this speaks to the need for marketers themselves to understand the interplay of basic human needs that are provided by the environment and how access or lack of access to these needs impact the health of societies. And again, we're talking, I'm talking in the broad terms about the established fact that 80% of illness is driven by social determinants of health, and how people interact within this environmental ecosystem where you live, where you work, where you go to school, where you worship, all the drivers that determine if one has access to the basic entities of clean air, clean water, access to food and shelter. All of this impacted by climate change, and it shifts the messaging. The messaging, it appropriately should shift the messaging to awareness of the environment on the one hand, and the personal responsibility for self and surroundings on the other hand. Had this been emphasized consistently during the pandemic, in the early stages of the pandemic, I think we would have had a shot at a more optimal output than we have had thus far.
Rachel, comments?
Yeah, I mean, I think that one of the things that we should start by acknowledging is that climate change and the pandemic and what we've seen play out over the course of it are inextricable. They're not two different things. They are actually part of a larger trend, a larger set of growing imperatives. Similar to the pandemic, as Dr. Aluko was mentioning, those that had the least suffered the most. We saw that we came face to face with the fact that climate change is a human-driven phenomenon. When we went into lockdown, we saw the skies clear in many cities across the world because we stopped driving, we stopped construction, and if you ever needed visual proof that climate change is driven by human consumption and the human condition, that was the moment. But we have this opportunity, like right here and right now, because there is a profoundly elevated level of awareness across the general public, across the entire world, that the air we breathe impacts our health. And this is just as much related to climate as it is related to an airborne disease. That linkage is something that we can really capitalize on in this moment to help people to understand that climate change is a human health issue. And one of the things that it most immediately impacts is our lungs, is our ability to breathe. Bob, you talked about the hundreds of thousands of people that the latest climate report suggested would die as a result of climate-related impacts. We see that many people die, hundreds of thousands of people die every year because of air pollution. Again, a human-made phenomenon directly tied to climate change. When you have a baby in a major city in China in the winter, they tell you not to bring that child outside for the first 3 months of its life because the air quality is that bad. And now we're seeing that same phenomenon repeat. That's not limited to China anymore. That's happening in Australia. That's happening in the Pacific Northwest and in California. It's impacting us all over the world. One of the lessons that we can learn from previous pandemics is that often during the course of that pandemic, just as we've seen with this one, there is a kind of coming together of public health community with other practitioner communities like architecture and design, for instance, come together around what we can do to really fight this disease. And we've seen, for instance, that our buildings can be frontline caregivers in the fight against COVID-19. They can also either be enormous contributors to climate change or real contributors to the solution. But what happens following the introduction of a cure or a vaccine, for instance, is that you actually see that fracturing happen once again. Like everybody just goes, okay, let's go back to our life as we once knew it. Right. And I think that, you could say that this is not a moment to be wasted. You could say the same thing for, the PR and comms community and the role that they play in really making sure that we don't let go of this opportunity where the public has an elevated level of awareness about how these things impact them, impact their lives, and a desire to get back to the life as we knew it, but also to preserve life as we know it. And that's really where we can make that leap to the climate conversation, but one that keeps it much more local, keeps it much more focused on what each of us really want in our lives, want for our families, want for our children.
Profound level of awareness of air quality is true, but it doesn't permeate all communities. Yeah. That level of awareness is lacking in certain vulnerable communities. So that's one issue, which is an opportunity for us to work on through marketing and public health. But the more tragic aspect to this is that those that are aware, that have the profound awareness of the environmental risks that cause respiratory disease and do nothing about the fact that they are aware that certain populations are excessively exposed to that environmental risk is a larger tragedy.
Well, thank you very much, both of you. Unfortunately, we could go on for another hour on this topic. It is a pressing issue, and the environmental justice and the social determinants of health are really public issues of how we confront these global issues of public health and climate change and other air pollution issues and water access to water, and the impact on the disadvantaged community, as was referenced earlier, those that have the least are impacted the most by these kinds of public health issues. I want to thank you both for your insights and your thoughts. They've been terrific, and really appreciate the opportunity to have you on today to share your thoughts with our audience. And thank you both for being here.
Thank you.
Thanks for having us.